Hi, welcome back to The Kid Fix. I'm Dr. Kat. Today we're going to cover one of the most troubling problems for parents: vomiting. When your child is vomiting, it can be very scary because you feel like you have no control over the situation. The most important thing to do during any vomiting illness is to support the child's hydration. Vomiting may be caused by many different things. One of the most common causes of vomiting is called viral gastroenteritis, or vomiting from some kind of viral illness. This can be with diarrhea and sometimes without diarrhea, sometimes with fever and sometimes without fever. Vomiting from a viral illness typically can last anywhere from 1 to 5 days. Treatment for viral gastroenteritis is supportive. That means there is no specific medicine that will help us get rid of the illness. Really, time ends up being the best medicine. The most important thing to do during a bout of gastroenteritis is to make sure your child is well hydrated. Other causes of vomiting include food poisoning, headaches, motion sickness, or allergy. Usually, symptoms of food poisoning occur anywhere from 8 hours to 24 hours after ingestion of the food in question. Symptoms of food poisoning can include vomiting, abdominal cramps, and fever. Vomiting in the child is usually not an emergency. However, there are certain signs that could make vomiting a symptom of something much more dangerous. If your child is vomiting blood, then we worry about some kind of tear or ulceration along the gastrointestinal tract. If you see bile in your child's vomit, or bright green, that could be a sign of obstruction or a blockage in your child's intestines. In the case of bloody or bilious vomiting, or when you see blood or bile in the vomit, those are both reasons to consider taking your child to the emergency department. At the very least, you should be in contact with a healthcare provider at that time. If your child is vomiting every time they eat any solid foods, then it's time to focus on liquids. Typically, we recommend clear liquids. While Pedialyte or its generic forms are a great way to rehydrate a child, they're not necessarily necessary, and many children will not like the taste of Pedialyte as it includes some salt and sugar. A recent study showed that apple juice mixed with water, 1 part apple juice to 1 part water, was just as, if not more effective in rehydrating the vomiting child. Other options include Gatorade mixed with water or Sprite or 7-Up. Even pure water is okay. However, one of the benefits of liquids with a little bit of sugar or salt in them is that they do give your child electrolytes that they may have lost during the vomiting and sometimes during the diarrhea. The best way to rehydrate your child is by starting with small sips. Usually I tell parents to try 1 teaspoon of fluid every 5 minutes for approximately 30 minutes. If your child is able to keep those liquids down, then it's a sign that you can start increasing the amount of fluid the child takes. Generally, I recommend continuing with a pure liquid diet until you're sure that the child is no longer vomiting. After that, it's okay to start with solids. The American Academy of Pediatrics has taken away their previous recommendation of the brat diet and now recommends that the child eat or drink whatever he or she can tolerate. Having said that, after several days of vomiting, sometimes the brat diet does feel better on the gut. If your child can tolerate these basic carbs, then it might be a sign that he or she is ready to try more regular foods. During vomiting, there's no specific foods that are absolutely not allowed. However, avoiding spicy foods may be a good idea as they can irritate the throat during vomiting and also can cause burning during diarrhea. Avoiding citrus might also be a good idea as it can cause burning in the throat or during diarrhea. One of the most common questions I get around vomiting is the fear that their child is not eating. Not eating for one night or one day is not going to be too detrimental on the previously healthy child. Can my child continue taking milk during their vomiting illness? There's no contraindication to milk. However, milk might be a little too heavy on the gut, and if you're noticing that your child is vomiting every time they drink milk, it's a good idea then to stop the milk and move to a clear liquid diet. In the breastfed infant, the best idea is to try to continue breastfeeding if the baby can tolerate the breast milk. If the baby is vomiting every time he or she drinks breast milk, then even in those cases it's a good idea to move to a clear liquid diet. One medication you can ask your child's doctor about is one called Zofran or ondansetron, which is an anti-nausea and vomiting medication, was originally made to help patients deal with the nausea and vomiting that occurred during chemotherapy. It's safe in babies 6 months and older. It comes as a liquid, a tablet, or a dissolvable form. This medication is by prescription only and can be given approximately every 8 hours as needed for nausea or vomiting. One of the things the parents I work with find challenging is assessing whether or not their child is dehydrated. Trust me, doctors and nurses have a hard time making these assessments too and often differ on their opinion. A lot of this comes with experience. There are some objective measures though that help us determine whether a child is dehydrated or not. The easiest way to tell if your child is dehydrated is to count the number of wet diapers or the number of times your child has gone pee. If you have a baby that typically has 6 to 8 wet diapers in a 24-hour period and has only had 1 wet diaper the whole day, then you know that the child is behind on his or her fluids. If your toddler typically goes pee 3 to 4 times a day but has not gone at all, or for example that usually they wake up with a saturated wet diaper and have woken up with a dry wet diaper, that might be a sign that your child is not as hydrated as they should be. The required number of wet diapers or voids or pees in a day really depends on the baby or child's age. Typically though, your goal is to get the child or baby to get to the same number of wet diapers they would have had before their illness. Another thing you can look for to assess a child's hydration is his or her overall energy level. Children will generally be a lot less energetic during a vomiting illness, and that's a given. However, if your child is completely lethargic, not moving, refusing to walk, and not taking fluids, that's a sign that you likely need to take your child to the nearest doctor or emergency department. He or she may need IV fluids. Despite what we see in popular culture, the best way to rehydrate anyone, including children, is through their mouth. In the setting of vomiting, it's tough to decide when your child needs to see the doctor or go to the emergency department. If your child is lethargic, if you cannot get your child to drink, if you could not increase the number of wet diapers or voids your child is having, if your child has abdominal pain that is worsening, those are all reasons to take your child in to see the doctor or the emergency department. Vomiting that's associated with headache or vomiting that relieves the pressure of a headache can be concerning. If this is the case for your child, I recommend an urgent doctor's visit. So just to recap, vomiting in and of itself is not an emergency. The most important thing to do during any vomiting illness is to try and rehydrate the child. The cause of vomiting can be many things. Most commonly, it's a viral illness. However, often it can be food poisoning. There are other more serious causes of vomiting. Therefore, if your child has severe and worsening abdominal pain, if your child is lethargic, if your child is vomiting blood or bile, if the vomiting relieves a headache, those are all reasons to take your child in to see the doctor or to go to the emergency department. If, however, you can rehydrate your child, they're able to keep some fluids down enough that they're peeing, that they have some energy to them, and the vomiting is getting less, then it's okay to continue to watch your child at home. Thank you so much for watching. Make sure to like, subscribe, comment, and share.